Hello, welcome back to the CAT Scan Guru podcast. Hope you guys are having an amazing week. Can you guys kind of believe that it's April already? It has been wild. I think 2026 is kind of just skating on by, and like summer will be here before you know it. I know I am getting summer ready and just upping my workouts, and I'm doing pretty good as far as that. If you follow me on TikTok, I do post some gym content, even though I'm not a gym content creator, but gym and the fitness lifestyle is one of the things that is really big in my life. And I think I'm in better shape now at 48 years old than I was in my 20s. So pretty proud of the progress as far as that. So little housekeeping. I know if you follow me on TikTok, I have released a couple of very good resources for the new CT technologist. So there are two things that I do have. The first thing that I did release probably almost about a month ago is the Core CT Protocols Guide. So it's an awesome guide. It's got about 10 different protocols. You can get a hard copy version or a digital copy that is available in my Etsy store. I've been trying different platforms and things like that, and Etsy seems to be the one that sticks and is easier for me to manage. So, because Shopify was just too freaking difficult. So it's easy to follow. Plus, when you get that as a bundle, whether it's a hard copy, digital copy, you do get the two courses and the audio series that I do have. So the Common CT Exams and Protocols course and the Contrast Media course. I'm in the process of making another course to add to that, so stay tuned for that. Also, I have just released it's a mini pocket guide. So I've incorporated a little bit more protocols into this one. This is what we call a scan ready. It's a CT Pockets protocol book. So it's something that you can put in your scrub pocket that you can take with you. It's got 16 of the most common protocols. I took it as a little step further. It's something that you can just flip through while you're on the job, you're training, whatever the case is. And also, when you get that as a bundle, because it's a hard copy and a digital, because I know I have different types of technologists that like different types of things, considering if you like more digital or hard copy, it doesn't really matter. You also get access to the two courses and the audio series with that as well. So if you want to get any of those resources, make sure you guys check out the show notes. Links will all be in the show notes, so you can go ahead and get your copy today. Also, I know I had one of the comments in one of my TikTok videos about making my courses CE courses for points. Well, you're in luck, because I did create a kind of like a CT 101 basics course. It's a part of Rad CEU providers. It gives you 4 CE credits that counts towards your biennium. So I will drop the link on that as well, so you guys can get in on it. It's a course I did probably back in, I want to say 2020, 2021. It was around there. So it was one of the very first courses I started teaching. And it wasn't that great, because now I've just improved my skills as far as teaching. So if you guys want in on all the action, make sure you check out the show notes, and make sure that you guys subscribe to the podcast. Can't tell you how grateful I am every single month that more and more of you are listening and sharing and just enjoying the content. And I want to say thank you to everybody that has purchased the guides and the pocketbook, and we'll be creating more stuff as we go along. So make sure you guys check that out and get your learn on. In today's episode, we are going to talk about why new CT technologists struggle with decision-making and how to fix it. Now, there's a lot of hustle and bustle when it comes to CT, and departments are really super busy. Most new CT technologists don't lack skill. They lack decision-making, and decision-making is a of what we do in our job, because there's a lot of decisions that need to be made, and sometimes like on the fly. So this episode is going to talk about why CT feels less stressful when you don't have like a structured framework, like structured training, just a structured process in your department when you're training techs that are transitioning from X-ray to CT, or even a new traveler that is coming into your department and helping you out for 13 weeks, how you can make that process for them less stressful. Okay. But let's think about what the issue is. The one issue that I can think of is that sometimes there's no thinking process behind before we scan anybody. or there's no thinking process before scanning because we have to train quickly. We don't have time to train. There are some techs that unfortunately don't like to train new people, or we expect travelers to already know what they're doing. And sometimes you do get a traveler that is brand new that really hasn't spent a lot of time in CT, which we've come across that in our department. So what does this do? There's a lot of hesitation when it comes to scanning. There is a lot of over-checking everything, overthinking, overdoing everything. There's a lot of anxiety that comes when protocols aren't clear or there's no understanding behind that. And there's always a fear of making mistakes. And the making the mistakes is really a big one because you want to set all the technologists up for success and not making sure that they repeat their mistakes. So what we have to look at is that CT is not just a technical thing. Okay, there's a lot of decision-based making that we do. Is this appropriate amount of contrast okay for this patient? Do we need to lower it? Do we need to give more? Is this IV correct? Do I feel comfortable injecting at 5 cc's per second for this cardiac, with this line that I have that might be a little bit iffy? Is the patient going to be able to drink contrast because the physician wants them to drink contrast? Is it safe to pause this medication and call the nurse because they only have one IV line? We got to use the IV for IV contrast. So there's a lot of decisions that have to be made, and a lot of times we have to make them on the fly, especially if patients allergic to contrast, diabetic patients who are pregnant, who are female. So there's a lot of decision-based making that is done in CT that we have to prepare the new technologists for and make it a very simple, easy process for them to do. Now, most techs were never taught how to really think through like a protocol or an exam because we're rushing the training. We're giving technologists 4 to 6 weeks training and then expect them to be on the shift to cover the shifts. Tell you why. There is a huge shortage in a lot of CT departments around the country. I know that there are several hospitals in the city that I live in that this is a common phenomenon. And I can tell you at my facility, we have taken on probably more travelers than I have seen in the amount of time that I've spent there. And I've worked at that hospital for a long time. So the thing is that because we're rushing the training, there's no real training structure. We don't have time to train. The ER is really, really busy. Our work lists are just longer and longer. And it's just a shit show when it comes to the work and the high capacity and high demand that we have to meet as far as turnaround times. So a lot of the new technologists are not taught how to think through, a scan, a protocol, or if something goes wrong. Now, what would really help is if we create some kind of simple decision framework so that removes the hesitation from, okay, is this safe? Is this that? Where we can give them some critical thinking skills and saying, okay, this might be a little iffy. Let me get a second opinion before I say yes or no. Or let me check the labs before we even put the patient on the table, check their IV, and making sure that the test matches up with what they're looking for. So if we have just a structured based just program, framework, training process, whatever the case is, I think it would make the decision making and give these new technologists a really good framework and how to map out how to train properly. Okay. So some examples of like the decisions, does this exam that they've ordered rule out what the reasoning behind the exam is? That's one. Or does this protocol match what they are looking for on this exam? Or do I need to make any adjustments as far as, let's say, for example, you have a patient who is like 98 pounds versus, another patient that is 490 pounds. Like, where do I need to adjust contrast? Or do I need to use a bariatric protocol, for the larger patient to make sure that I get an optimal exam? So how does this help us? So your decision making becomes a little bit quicker because a lot of critical thinking in CT, we have to think outside the box a lot. And because all the patients are different and we see a lot of acuity, especially there's sicker and sicker patients nowadays because, people are afraid to come to the hospital. They come to the hospital when, it's really, really critical and they should have been there a long time ago. We start to see a lot of scenarios on, the patient population. And, the patient population, there's older patients, they're getting sicker and sicker. A lot of them return, things like that. So we have faster decision making where we know exactly, okay, this may not be a good IV. Okay, maybe let me ask the doctor to clarify this order. Okay, this is how much contrast I'm going to give on this patient. What that does is it also creates less anxiety, where you know how to think and to make sure that you execute the right thing and do the correct protocol and the correct test the first time. It lessens your anxiety, makes CT a little bit easier, right? So, and then you have more control, not only the scans that you're performing, but just the job itself. You have more control, you're able to just execute those optimal exams and making sure that you're scanning correctly and making sure that you're doing the exams properly. Okay. So a lot of this that we go through as far as struggle with decision making, I think it's just because we're throwing in techs that are brand new and that we expect them to do the job in a month and a half, which is unreasonable and unrealistic if you ask me. I think that at least if technologists have at least 12 weeks of training, I think that is sufficient to know the basic exams, like the bread and butter of CT, and how to execute them correctly. Because if you give them that 12 weeks, I'm pretty sure that they can execute a simple head without contrast, a simple PE study, a simple abdomen and pelvis with contrast, run a stroke protocol. I think as far as those core basics, you can do that because the rest of it, as they continue working, they will pick up along the way because everybody's pace is different. Some techs learn quicker, some need a little bit more time, and that is okay. Because if you need more time to grasp the technology, the terminology, and just how we do things, repetition and practice is going to be your best friend. So if you want to have a structured way to think through CT protocols, my protocol guide bundle and the mini pocketbook is your go-to, and it is a reference to help you in your CT training. Now, I want to give you a little disclaimer. This does not replace your site-specific protocols or any radiologist recommended protocols. This is simply a reference to help you. So I want to make that clear. So if that is what you need, everything is linked in the show notes. So that is it for today's episode. Hopefully these talking points really hit home because decision-making and thinking outside the box is one of the main things in CT. It's probably why we're called rebels. So I think I saw that on the TikTok with one of the mutuals that I follow. She's freaking awesome. Also, make sure you follow me on TikTok because I do a lot of protocol videos and I break down a lot of simple things that we should know in CT. And I'm going to start making some more educational content on YouTube. So what I'm going to start doing is taking one CT protocol, we're going to break it down, and hopefully you learn how to execute that protocol correctly. So as always, thank you so much for all of you that continue to listen. Thank you to all of you that have purchased the protocol guides and the pocketbook, and go and just continue to support me in this endeavor because I am truly grateful and I appreciate you all. So thank you. So thank you so much for listening to this episode, and I will chat with you guys in the next episode.